Welcome to Dateline Health. This is Fred Lippman coming to you from the Alan B. Levan Innovation Center at Nova Southeastern University, which is a combined effort between Nova Southeastern University and the County of Broward. And we have a very interesting show today about interventional pain management and non-opioid solutions. There's been a lot of comments to us about opioid and opioid addiction. So we have Dr. Maria Cristancho, who is a board-certified anesthesiologist and pain management physician, and she presents her work in Pompano Beach, Florida. Welcome, Doctor.
Good morning. Thank you, Dr. Lippman. Thank you so much for having me today. And thank you to all the team at Dateline at Nova Southeastern University for having me today.
Good. So just topically, tell us what your presentation is to your patients.
Well, here in my practice in Pompano Pain, I mostly present my patients with an alternative for pain management that I like to call holistic. That's why in my own logo, my own presentation, the holistic word is very important. It also reads interventional pain management. It basically presents the patient with an option to treat the chronic pain, so a pain that lasts more than 3 months, as an integral treatment plan that not only offers medication options, but also offers mind-body solutions to treat the pain, as well as interventional options.
Dr. Morton Terry always used to say, we have to teach not only technique, but we have to always keep in mind, body, and soul.
And I couldn't agree more, especially for pain. So when I say chronic pain, there are different types of pain. Chronic pain is a type of pain that usually lasts more than 3 months by definition. So it's not the acute pain that you have, say, after a surgery, after an injury, after having a laceration or a bump in the head. It's a type of pain that lingers on more than 3 months usually, and not only affects the physical part of the body, but also the emotional part of the body of the human being. That's why I stress the importance that chronic pain, and we receive it in our training. We train under like board certified fellowship programs, are teaching this, what we call biopsychosocial model of treatment of pain, of chronic pain. So it's not the typical acute pain that you may get for a few days after having a surgery, having your gallbladder out, having your appendix taken out. It's a different type of pain that has to treat the human being as a whole, as a holistic type of treatment plan that has to be offered. So chronic pain is a complex condition. So, and that's why I try to offer a multimodal, multidisciplinary way of managing the pain. And what do I mean by that? It's not only in my hands, it's also in the patient's hands for the treatment plan. It's also in the hands of a physical therapist, perhaps. It's also in the hands of a chiropractor, of an osteopathic manipulation, for example. Medications can come in useful at times as well, intervention. So it's a full circle that has to be addressed. The emotional part of pain as well has to be addressed, which is very often missed and very often neglected. Say, for example, to say something during the consultation, the physician doesn't have time, the physician doesn't have the purpose of addressing the emotional part of what chronic pain means to the patient.
Management. Management is a very important term, I believe, and you can tell me otherwise or whatever, in the area of pain. We have one of the finest, and not by my words, but by national accreditation words, we have some of the finest physical therapy programs in the United States right here.
Absolutely, very important. And not only that, you mentioned allied health professionals, there needs to be an improvement. I strongly believe in not only medical training, but also in all of the other healthcare professions about what chronic pain is and how to treat it, and what education and what modalities are also, what resources are also available for the patient out there, for the community. Many times I hear it from my patients themselves. They come and they don't know what a pain clinic is like. They call because they have been referred by either another specialist or their primary care physician, and sometimes they're even afraid or weary about calling the pain clinic because they think a pain clinic, it's a medication clinic. That's what I usually receive communication from the patient. So yeah. So I find myself very commonly presenting the patient with other options for pain, and sometimes they are really surprised because they never knew that these other alternatives, injections, or even physical therapy. Some patients are even surprised that their primary care doctors have not referred them to physical therapy or other modalities. Acupuncture, for instance, for some patients with chronic pain has been shown to be helpful. So it's a matter of educating the community that a pain clinic, and of course, if we go back, this is another topic for many days to cover, but if we go back to all the opioid epidemic, the 1980s, so of course, I can only imagine why the community and the patient population, of course, the first thing they think about when hearing that you're being referred for a pain clinic is medications.
Well, yeah, I was going to get to that. You know, as you've probably been told by our magnificent producer here, that we've had, you know, this program really goes along all these years with questions that come from the viewers. They entice us to bring up different areas, subject matter. There are two areas that fit into their questions. Number one, the three top issues that are always, over the years, have always been cancer, heart disease, and pain, surgical pain, all right? And then when we started to talk about minimally invasive techniques, it sort of knocked out pain issues, and that became the number 3 item that the people talk to us about or ask us questions about. We don't answer the questions. We got people like yourself, healthcare professionals, to come on and talk to the viewers and make them aware of what information is available. But recently, we've had a lot of communications about, I guess you could say, opioids, fentanyl issues, the death of children, the number of problems that it brings to our society. And I think there's a lot of it has to do with non-knowledge of how to deal with pain. And here we have you, a board-certified anesthesiologist and pain management person, and you can give them a lot of insight, as you started to do, relative to how do we deal with the products that are available, or what are the alternatives to the products that are available. So I'm throwing it right back at you.
Right. So many alternatives that we use to treat chronic pain besides the opioid medications, or also called narcotic medications, are varied. For example, other medications called adjuvants, some other classes of medications that we use in other areas or in the field of chronic pain, such as, for example, anticonvulsants or antidepressants that are also used in the treatment of chronic pain, especially for neuropathic pain or nerve pain, what we call nerve pain. There's other alternatives such as injections, cortisone injections that can be done either close to a nerve that is affecting or causing pain, or cortisone injections that can be done into the joints. More invasive procedures that we typically do also in the office are things such as the spinal cord stimulators, which is also a relatively recent topic. When I say recent, it's 20 years that has been in use for the treatment of chronic pain, especially patients who have had surgery in the lower back or in the neck and continue to have persistent pain despite the surgery. So spinal cord stimulators. And more recently, we're also using the same technology to treat, for example, other areas of pain in the extremities, such as peripheral nerve stimulators. And those are still minimally invasive techniques to treat chronic pain. These procedures are usually done in the office. Some of them require some sort of sedation in a surgery center, and very few require general anesthesia to be performed. So those are within the alternatives. And pain medicine, it's a very vibrant, ever-evolving field. So every day, every week, there's more research coming up, more minimally invasive alternatives to treat pain as well, because not only pushed by the patients themselves that are also asking for new alternatives, new options, new permanent solutions, or new permanent management for pain. So many techniques are coming up for the treatment of arthritis, pain in the lower back, for example, or spinal stenosis, which is also a very common condition and very common cause of back pain.
Well, you know, the reason I think, you use the word permanent, which is very interesting, because we get that question. We got a number of questions relative to, well, how do I get rid of this pain and not have to go see the doctor, you know, every 2 weeks or every 2 months, whatever. I mean, you know, we've had all kinds of questions about that. But the query by the people out there is also, we have some people who read a good number. Don't forget, a lot of the folks that are watching us, not only the people who view it during the daytime, which is 12:30, but it's repeated a number of times during the week, and we have a later evening program schedule. And we hear it relative to people who are reading a lot. And there's been a lot. We had questions brought to us about the use of lasers, which are now being used in Great Britain to a great extent for pain relief. You want to communicate some information about that?
Yeah. One of the techniques that has been proposed for the treatment of chronic pain, especially for low back pain, has been the treatment of laser, or the use of laser therapy, say, for example, for degenerative disc disease. These are also considered minimally invasive procedures that they're mostly performed by neurosurgeons. And then they also have varied results, and reason why the FDA has not approved the use of these. So if they're used, they may be used off-label for the treatment of degenerative disc disease. But these are alternatives that are offered to the patients as well, who have tried multiple other options before: cortisone injections, spinal cord stimulators, even surgery. So that's one of the emerging techniques that is being proposed for the treatment, especially of degenerative disc disease, in an attempt to remove the parts of the disc that are herniated or are coming out of their natural anatomical position in very selected patients with, again, varied and different results.
You know, we have the privilege in the state of Florida of having the greatest number of people, percentage-wise, of any state in the union of age 70 and older. It's a fear. I mean, once you get to be, 70, 75, 80 years old, you don't want to be lying in a hospital bed.
It is a real fear, of course. And as I always say, it's the accumulation of years of youth that starts kind of taking a toll on us. And pain is very common. We all have pain in one way or another. Pain, like a famous phrase, pain is inevitable, but the suffering that comes with it is something that we can modify. But pain is going to be inevitable. The physical pain is there, the physical pain. And one word that I usually try not to use very often is the famous word written on the radiology reports, the word degeneration, degenerative. So that's something that would scare anyone, of course, because the first thing that you're thinking, my body is degenerating, my body is breaking apart. So that's only a term, a medical term, to express or to describe the normal process of the body, of the joints, the normal process of the cartilage, the normal process of the joints that they develop as we accumulate years of youth, once again. So it is kind of a misnomer or a misguiding term in a sense for many patients, and I see it very commonly. But yeah, the search for minimally invasive techniques is always there, and we use some of them. I use some of them here in the chronic pain clinic as well. And it comes to the matter of living well with pain. Again, because pain is something that is going to come inevitably, and perhaps the fear when one is dealing with the chronic pain, non-malignant, and I'm almost always referring to non-malignant pain, non-cancer related pain, chronic pain from the lower back, chronic pain from the neck, or so many chronic pain ailments that could occur in the human body. So it's something that yes, many minimally invasive techniques are coming up, and some of them, the only thing that I would tell the community, of course, and I would want the community to know, is to make your own research, make your own informed decision as well, because you're going to see many different facilities, many different doctors or health allied professionals offering a cure, a fix-all for pain. So make your own research. Who is doing these techniques? Who is offering these procedures? Is it FDA approved? Is it something that has a research that is significantly showing results? Does the research have more than 20, 30 patients that could show favorable results? What are the complications also? Because they may be offering this fix-all 100% pain relief procedures. What are the complications? What are they actually doing? So that's one of the main things that I would want the community to make their own informed decision in terms of these newly evolving techniques, minimally invasive, fix-all, no pain.
You know, one of the things, and I would assume, and you could, this is really a question for you, that's coming from me, and that is, there have been such amazing new opportunities to scan the body. There are so many new management tools, as I believe they are, or lead you to management, but you have to see things, you know, and you can't just assume. Again, that's a very large word, assumption. There should never be an assumption in medical care. I think that there has to be a reasoning for doing something. But having these new scanning techniques, I think must be very valuable to you as an interventional pain manager.
It is absolutely valuable, and that's our daily tool. Fluoroscopy, or an X-ray, a portable X-ray machine that we use on a daily basis to guide our injections to the correct anatomical target. So that's one of the things that assures correct needle placement and a favorable result with minimizing the risk of complications that may occur during any procedure, not only for treatment purposes, but also for diagnostic purposes. So these MRIs that we order are coming up with these new technologies, 3.0 Tesla, it's one of the most advanced imaging techniques that one can have when having an MRI. The detail of the soft tissues, the detail of the anatomical structures is significant.
It would seem to me, I don't talk about my own little body here, but you know, scanning is such a magnificent, and especially the new scanning techniques, and capabilities. They're a wonderment as far as I'm concerned, and I would assume as their adjunct to your knowledge, not only relative to your treatment, but why and how you're going to treat it. Is that correct?
That is correct. Yes, I typically use an ultrasound almost on a daily basis, even for exams. For exams during the patient consultation, I have my ultrasound as an anesthesiologist, and ultrasound is like my stethoscope, my adjunct to visualize the soft tissues, the joints, if there's any fluid collection. And then, of course, when the patients are sent out for other imaging or more advanced imaging techniques, well, MRI becomes our workhorse. And again, every day they're coming up with advancement in the imaging techniques, even 3D imaging techniques that allow us to see the whole body in a 3D structure, to assess for any malalignments or any displacements. So it's fascinating how radiology and imaging techniques are evolving.
Let me ask you just very quickly. We also have a very well-known nutritionist program, and we find often, no matter what it is, heart disease, bone and structure issues, and otherwise, that there is a nutritional component that should be valued relative to the care of the patient. Do you agree?
I agree. In chronic pain, as part of the multimodal pain management, nutrition and diet and lifestyle habits is a key important it's a key factor to treat or to assess. Diet, there's a whole chapter in chronic pain and diet and such. Of course, there are many treatment alternatives in terms of improving chronic pain based on our nutrition. That's why we hear the word anti-inflammatory diet. So avoiding sugary, fatty foods to improve chronic pain, because chronic pain has a very important inflammatory component. So if we avoid, that's why we typically use, for example, medications such as anti-inflammatories, ibuprofen, Aleve, different medications to treat inflammation. And then we improve also the diet and the nutrition by avoiding inflammatory foods such as, again, sugary, fatty foods. There's many supplements that have come to play, and there's many research around the type of supplement that should be prescribed. At this moment, we don't have a research guideline, for example, to base ourselves upon and prescribe those type of supplements. But of course, you hear very often research on turmeric, research on cumin, research on ginger, things that could pose an anti-inflammatory benefit. So that's also one thing to consider within the treatment of chronic pain.
The community out there that watches, it's really difficult. I mean, they pick up something in a supermarket, and you turn it over and you see, you see sugar, but then you see about 15 lines and you really don't know what those lines mean. And, a person can't go to university to find out what every one of those products are. So it is daunting, that.
It is daunting, and it's part of what I call self-care. And that's why, again, you should always look in your doctor for a board certified physician in either a specialty and then the subspecialty of pain, because we have that multimodal kind of holistic training, and we know the different factors that affect chronic pain. We not only focus on medications, we not only focus on interventions, which is one thing that I hear very often. The patients go to a pain doctor and then they don't talk about the rest of the factors that may affect their own pain. So it's important, of course, to be, again, and to the community, to be knowledgeable in a sense, maybe getting some guidance from your physician, from either the primary care doctor or from us, pain physicians, regarding supplements, because it's daunting. You go to the supermarket, you see all this supplements saying, again, 100% pain relief or fix all and brand new cartilage formed in your joints by 2 weeks. things such as those statements. So it's always something to take as a grain of salt and be informed and ask questions. Some of these supplements don't even contain exactly what they read on the label that they contain. So always be informed and ask your doctor about taking a new supplement.
Well, we're down to the last minute of this show, Dr. Cristancho, and I want to thank you very, very much. I always tell our viewers, if something is bothering you and you are in pain or you have multiple problems, whether it be gastric problems or whatever it is, dental problems or otherwise, don't just run into a supermarket or a pharmacy and pick something off the shelf and think that you're going to be able to, mitigate the problem or cure the problem. It doesn't work that way. See your physicians. Get a valuable communication going between yourself and your physician, your primary care physician, who will have knowledge about people like Dr. Cristancho, and if necessary, they're going to communicate with Dr. Cristancho and ask the patient to make a visit to her office in Pompano Beach. So thank you very, very much for showing up. Again, I know you're in Pompano Beach, and tell us what the address is.
It is 1800 North Federal Highway.
Okay, so that's easy to get to.
That's easy to get to, yeah.
Easy to get to. Thank you very, very much. We appreciate your time. We appreciate your knowledge.
Well, thank you so much again for having me for the show and sharing a little bit of what I do. And I'm here in Pompano Beach for whatever needs may be.
Remember, folks, this show is called Dateline Health. If you have any questions or comments, there's an email address right here. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.